to today's session. Over to
Thank
you,
you.
sir.
So good evening, all. Um, so can I share my screen?
Yes, sir. Yes, sir.
Is my screen visible? Is it visible?
Yes, a kind
Yes,
of
sir.
purple color.
Okay. So good evening. I'm Dr. Anish Rajan, Assistant Professor, Department of Forensic Science, Christian Jayanti University. Uh, a very good evening to one and all. So today's topic is penology and correctional administration, from punishment to evidence-based rehabilitation. I think all of you have already gone through the theories of punishment and the different types of punishment, right? So that's what I thought. Like we'll go with the next level. This is the outline of the lecture. So the outline of the lecture is today we are going to talk about evidence-based practices in Indian correctional institutions. I'm not going with the theories. If you want means we can go with the different types of punishment, theories of punishment. Uh, is there anyone comment? Can you just come in,
No, sir,
brother?
you can go ahead, I think.
Okay, I think you all of you have gone through the theories of punishment, right? Fine. So today, like my topic is evidence-based practices in Indian correctional institutions. So we go with criminogenic needs, risk. So what is risk and need assessment? Risk need responsibility principle. What is R&R principle? And what is the importance of risk and need assessment? What is how we can apply that risk and need assessment in Indian correctional institutions? And what are the different risk assessment tools? And what are the challenges of implementing risk and need assessment tools in Indian prisons, okay, or Indian correctional institutions. So this is an overall outline of our today's lecture. Is there anyone know like what is criminogenic needs? Anyone? Okay, so have you heard about criminogenic needs? Criminogenic needs are nothing but crime-causing factors. Crime-causing factors. Okay, so there are multiple factors. A person is committing crime because of multiple factors are there. So it is called criminogenic needs, crime-causing factors. And the next one is risk. Here, the risk means the risk of re-offending or recidivism. The term recidivism, I don't know whether you are familiar with the term recidivism. Recidivism is nothing but repeated offending. Okay, so here the risk is actually the risk of repeated offending. So we are talking about the correctional institutions. What are the evidence-based practices we can implement, integrate in Indian correctional institutions? So we do not follow any kind of evidence-based practices in Indian prisons. Okay, a critical statement. We do not follow that evidence-based practices. So this is so that's the reason I brought this topic as an evidence-based practices, integrating these practices to Indian correctional institutions. Then what is the risk and need assessment? So we talked about criminogenic needs, right? Then we talked about risk and what is the risk and need assessment. So what is the need of this risk and need assessment? Okay, so now directly we'll go to this topic. So I have given an outline of the lecture that what I'm going to discuss today. So what is criminogenic needs? Criminogenic needs are factors that contribute to an individual's likelihood of reoffending. These needs can be addressed through targeted intervention. See, like I mentioned, this criminogenic needs are nothing but the crime-causing factor why a person is committing crime. So there are multiple factors. You might have already learned different theories of crime. So there are biopsychosocial factors, right? Biopsychosocial factors are there a person committing crime. So those factors are called criminogenic needs, crime-causing factors. There are, when we are talking about criminogenic needs, there are mainly two types of factors. One is static factors and another one is dynamic factors. Static factors, there won't be any changes in the static factors. We won't be able to change anything in the static factors. And when it comes to dynamic factors, we can make changes. There is a control over there. The criminology needs are dynamic factors when addressed can reduce the risk of recidivism. So recidivism, that the term I have already mentioned, it is nothing but repeated offending. So these needs are distinct from static factors. Static factors are such as age of the offender or criminal history. So we don't have any control over the static factors. We won't be able to change anything related to this uh, static factors. But at the same time, these dynamic factors are we are having control. We can, through intervention programs or rehabilitation programs, we can make changes. So examples include substance abuse, lack of education, poor problem-solving skill, unemployment, poor family relationship, anti-social behavior. So these are some of the criminogenic dynamic needs, okay, dynamic factors that is a person committing offense. Okay, and just I wanted to before continuing with the next slide, and I just want to in between, if you have any doubts or you wanted to clarify something, you can ask. There is no problem like interacting in between the lecture. So I prefer that actually instead of it's a monotonous. Okay, so these are the major criminogenic needs. So here we are mentioning only the major criminogenic needs. Like already I mentioned, what is criminogenic needs? That is nothing but crime-causing factors. So criminal history. Criminal history actually a static factor. The all other like pro-criminal attitudes, anti-social personality pattern, family or marital issues, education or work-related issues, leisure or recreation, pro-criminal associates, and substance misuse or abuse. So these are some of the criminogenic needs. These are the crime-causing factors. We are only mentioning the major criminogenic needs. There are other criminogenic needs. We are only dealing with these 8 criminogenic needs. So these are the 8 criminogenic needs. Uh, so in like a with a simple interpretation with the example, and what will be if you're going through this table, criminal history. It is nothing but past criminal behavior. For example, repeat burglar. Okay. Then pro-criminal attitudes, thinking crime is okay. Some people they think the pro-criminal attitudes, that is a criminogenic need. Some people think that thinking that crime is okay, stealing isn't wrong. Okay. So that is what pro-criminal attitudes. The same way pro-criminal associates, criminal friends or groups, means peer pressure, peer groups. Okay, the criminal friends or groups, so they'll be involved with, they'll be associated with criminal friends or groups. Example is gang involvement. See, in the neighborhood and all their friends may be like,
Excuse me, sir.
yes,
Excuse me, sir. Sir, are you presenting any slide? We can't
you
see
know,
anything.
yes, I'm sharing a slide. The slide is not visible.
No, sir, it's not visible.
Okay, let me.
Just a pink screen there. We can't see anything.
Okay, better that I thought that you are able to see this slide. Let me check. Sorry, actually, I thought like you are able to see my slides. Okay. You able to see the screen?
Yes, sir. Yes, sir. Now we can see it.
Okay, better that you
Thank
have
you, sir.
told. So I thought that you are going through the slides, so that's the reason. Okay, fine. So I think outline of the lecture that I've already mentioned, I think that is okay. So criminogenic needs, we'll go with okay. So is it visible now?
Yes, sir. Yes, sir.
Yes,
It's
yes.
visible.
Fine. So these are the major criminogenic needs. We talked about criminal history, pro-criminal attitudes, anti-personality pattern. So family or marital issues, educational work, leisure or recreation, pro-criminal associates, substance abuse. So these are the major criminogenic needs, crime-causing factors, okay, risk or need factors that we are going to talk about. So here we only like selected only major criminogenic needs. There are other criminogenic needs, but we are only discussing about these 8 criminogenic needs. Okay. So criminogenic needs. So criminogenic need. So these are the 8 criminogenic needs. Criminal history. So that means in simple meaning, it is a past criminal behavior. For example, a repeat burglar, and pro-criminal attitudes, thinking crime is okay. Then, example, stealing isn't wrong. Okay. Then pro-criminal associates, criminal friends or groups, peer pressure, peer groups, gang involvement, for example. So these are examples for pro-criminal associates. And family or marital problems, conflict or poor support from the family. For example, neglect or abuse at home. And school work problems, poor performance or jobless. So example, dropout or unemployed youth, leisure recreation, unstructured free time, hanging with ideal peers, and substance abuse, addiction to alcohol or drugs, theft to buy drugs, antisocial personality, impulsive or aggressive trait, short temper, thrill seeking. So these are the criminogenic needs. So why we are going to discuss about this criminogenic needs is actually, so my topic itself, like integrating risk and need assessment in Indian correctional institutions. In our Indian correctional institutions, we do not have a risk and need assessment. In our Indian prisons, we do not follow any kind of risk or need assessment. So that is the importance of implementing or integrating this kind of evidence-based practice in our correctional institutions. Okay. So that is the first step is actually there is an R&R principle, risk, need, responsibility principle. So for that, before going to the risk, need, responsibility principle, that we have to have an understanding about what are the criminogenic needs. So these are the 8 criminogenic needs that we are talking about. If you have any doubt, means in between you can ask. Okay. So for example, what is pro-criminal attitudes or pro-criminal associates? So these are some of the crime causing factors why a person is committing crime because of these factors. Okay, so we are only talking about 8 major criminogenic needs or 8 crime causing factors. There are many other factors, but these are the major criminogenic needs or factors. So we talked about criminogenic needs, right? The 8 criminogenic needs that we talked about. Now we are going to go with what is risk assessment. Okay, so there are mainly 3 terms in this risk, need, responsibility. The first one is risk, then need, then responsibility. So we already talked about the need in the sense criminogenic needs, crime causing factor. So now we're going with the risk. So what are risk assessments? What is risk, first of all? Okay, risk assessments are structured tools used to evaluate the probability that an offender will engage in future criminal activity. They consider both static and dynamic factors. It is nothing but how likely an offender, there are chances of committing a repeated offending, recidivism. Okay, so there are first-time offenders. Then if you're conducting an assessment to the first-time offenders, then you will be having an idea what are the risks of their committing further offenses. There we can classify the risk into low risk offenders, medium risk offenders, high risk offenders. So that is what a risk means, a risk of re-offending or risk of repeated offending, risk of recidivism. That is what risk in this particular, okay. So that is what a risk. So there are different risk assessment tools are available, the level of service inventory, LSIR, and ORAS, Ohio Risk Assessment System. So these are some of the risk assessment tools. Okay. So types of risk assessment, there are static risk factors, the same way that we talked about static factors, unchangeable factors such as age, gender, and criminal history. We do not have any control over these risk factors. Okay. But at the same time, dynamic risk factors, changeable factors often related to criminogenic needs such as employment status, substance abuse, social relationships. These all we have a control over it through rehabilitation program or intervention program or a CBT, cognitive behavioral therapy. We can make changes into these dynamic risk factors. So before going to that, so risk in the sense, okay, so why do we need a risk assessment? What is the purpose of risk assessment? The main purpose is actually, for example, in Indian, okay, in this case also, we do not have, I've already mentioned, we do not have a risk and need assessment, right? So among the prisoners, once they are entered to the prison, we do not assess their risk or we do not assess their need. Okay, so we have, we follow that one size fits all, that policy that we follow. In our Indian prisons, what are the, especially in our prison center, what are the different rehabilitation program? They give education program, vocational training, or counseling, yoga, meditation. These are the practices that we follow in our Indian prisons. Okay, so that is actually one size fits all approach. For all the prisoners, whether their criminogenic need or crime causing factor may vary. Like we mentioned, it can be because of peer pressure, or it can be because of their substance abuse, or it can be because of pro-criminal attitude, or family or marital issues, or a lack of employment. There are like 8 criminogenic needs that we talked about, right? So there can be, so these persons are committing crime because of various factors. That is called crime causing factor or criminogenic needs. But in our Indian prisons, what do we do? Like, we give for everyone the same kind of treatment. There is no assessment, first of all, and the rehabilitation programs are generally common for all. Okay, so we give general vocational training, we have education programs, we have yoga, meditation, or these all recreation programs, right? So that is the importance of this risk and need assessment. So as per this R&R principle, we for a better rehabilitation and reformation and reintegration. Okay, so when we, I think you might have already learned about the penology and correctional institutions. What is the main objective of correctional institutions? The main objective, anyone? Okay, so the main objective is actually reforming the prisoners, right? Reforming them. That is a main objective. So the objectives, the theories of punishment, you might have already learned about what are the different theories of punishment. It starts with the retributive theory. So an eye for an eye, tit for tat approach. Then it is deterrence, a specific deterrence and general deterrence. And then preventive theory, incapacitating them, keeping them in the prison so they won't be able to commit further offenses. Then the next one is reformative. So here now the modern correctional institutions, they focus on, there is a paradigm shift from retributive approach to reformative approach. So now the modern correctional institutions, they focus on reformation, rehabilitation, reintegration of the prisoners. So that is a main focus right now. So that is the importance of integrating this kind of evidence-based practice in Indian prisons. So we lack this kind of risk and need assessment in our Indian prisons. So this is actually based on a risk need responsibility principle. The risk need responsibility principle, the first one, a risk is actually the chances of committing further offenses, the likelihood of how, what are the chances a person commit further offenses. Okay, so based on that, we can classify them in the sense, okay, for example, if you're taking a prison, central prison in Kerala, so then if you go into the central prison in Kerala, the convicted, there are two population, right, under-trial prisoners and convicted prisoners. When we are when we are doing an assessment among the convicted prisoners in our Kerala central prison, or any of the central prisons, for example, Trivandrum central prisons, convicted prisoners. So we are using a risk and need assessment tool. We are conducting an assessment to these convicted prisoners. Then we will be able to identify what are the risk level. Okay, for example, if there are 1,000 prisoners, out of these 1,000 prisoners, we can classify based on this tool, we can classify them. What are the mainly low risk offenders, medium risk offenders, and high risk offenders. So low risk offenders means there are very unlikely they might commit further offenses, and medium or moderate offenders, like risk offenders, there are moderate. Okay, and when it comes to high risk offenders, there are higher chances they commit offense when they once they are released from the prison. So why do we need a risk assessment? In the sense, once we conduct a risk assessment among these prisoners, then we will be able to classify them based on their risk level. As of now, we have different classification based on their age, based on their offense, or based on their number of means whether they are a recidivist or repeated offenders. Based on that, under trial prisoners, gender-wise, the classification we do have, but we do not have a classification based on their risk level. Okay, so high risk offenders, low risk offenders, medium risk offenders. This classification is not there. So for that, for classifying based on their risk, we do need a risk assessment tool. So why do we need this kind of risk assessment tool? Means as per this risk need responsibility principle. So risk need responsibility principle in the sense, it is very simple. We talk about risk, right? Low risk, medium risk, high risk. What are the chances of a person committing further offense? That is what risk. And when it comes to need, here in R&R, need is nothing but the criminogenic needs, crime causing factor, why that person is committing crime. And when it comes to responsibility, it is responsibility is nothing but what are the intervention program or rehabilitation program, how we can respond to their crime and how we can reduce their offending behavior. So the risk need responsibility is a key framework used in criminal justice and correction to guide the assessment and treatment of offenders. So it is designed to reduce recidivism by matching the level of intervention to the offender's risk of reoffending and addressing their specific criminogenic needs. So the R&R principle consists of three main components: risk, need, and responsibility. So we look at that image, risk, who we should treat. Okay, so who we should treat, that is a risk. For example, when we are conducting a risk assessment, we'll be able to identify low risk offenders, medium risk offenders, high risk offenders. So here the question is who we should treat. The focus should be on the moderate risk offenders and high risk offenders. Okay, low risk offenders, there are very low chances they commit further offenses. So we do not have to like focus on these low risk offenders. So there are less intervention programs are fine for them, but at the same time, high risk offenders, we have to have a more focus on them. Okay, so that is what here risk means, who we should treat. Okay, so mainly that we have to treat the high risk offenders. For that, we have to assess their risk, and based on the risk, we have to classify, and those who are in the high risk category, then we have to give more intervention program, more focused rehabilitation programs to them. And the next one is need. Okay, what we should focus on. The need is here actually crime causing factor, criminogenic needs, right? So what we should focus on. So we classify them based on the risk. Now we have to think about, okay, what we should focus on. Okay, like I mentioned earlier, in Indian prisons, we have one size fits all approach. That means for all the prisoners, we are giving same kind of, almost similar kind of treatment, rehabilitation programs, right? So that is the importance of this need assessment here. So we have talked about the 8 criminogenic needs. That 8 criminogenic needs. Here, when we are conducting a risk assessment and need assessment, risk assessment, we identify the level of risk. Then based on the level of risk, low risk, medium risk, high risk, we have classified them. And for high risk offenders, we are focusing more and we are giving more intervention program. But at the same time, low risk offenders, there are no need of any intervention actually. There are less intervention is fine. They are not going to commit any further offenses. Okay, so the more focus should be on moderate and high risk offenders. But okay, now we know to whom we have to focus, that we know. Okay, based on the risk way to whom we have to focus, that we know. So next is what we should focus on. That is what the criminogenic needs. So when we are conducting an assessment, like I mentioned that example for a central prison in Trivandrum, there are 1,000, for example, 1,000 convicted prisoners are there. So when we are conducting a need assessment, risk and need assessment, so out of these 1,000 convicted prisoners, there are 8 criminogenic needs, right? So some of them have substance abuse problems, some of them they have pro-criminal attitude, some of them have family issues. So there are multiple factors. So based on the what are their crime causing factor, so based on the crime causing factor that we have to treat them. Okay, for example, a person committed an offense because of substance abuse, then we have to give them de-addiction programs. So that is the way that we can utilize our resources properly and we can rehabilitate and reform that particular person. So there is no point for a substance abuse person giving an education training, vocational training, or any other meditation yoga. See, here the problem we are identifying is why that person committed an offense because of substance abuse. So we have to focus that particular crime causing factor or criminogenic need. So that is the focus we should on. And responsibility is actually nothing but how we should work. So first we are identifying the risk level, then we are classifying them based on the risk level, low risk, medium risk, high risk. Then we are trying to identify what are their needs, why they're committing crime, what are the crime causing factors. Okay. Then based on that, the rehabilitation program. Responsibility means how we are going to, how we should work, how we are going to treat them. So we identify their needs. So based on that, okay, for example, if there is psychological problem, then we may have a cognitive behavioral therapy, or if there is substance abuse, then we give de-addiction programs, or a family or marital issues, then we give counseling. So different criminogenic needs, we have different responsibility, okay, intervention programs to rehabilitate them. So this is an evidence-based practice. Okay. Okay, so this is a risk need responsive principle. Like I have already talked about the risk principle state that treatment efforts should be concentrated on offenders with the highest probability of reoffending. So our focus should be on the highest probability of reoffending. Those who are higher chances of committing further offense, we should focus on them mainly. This means that resources should be allocated efficiently to those individuals who pose the greatest threat to public safety. So why we are focusing on the high risk offenders, there are high chances they commit further offenses when they are released, right? Once they're released, there are higher chances. So they're a threat for the public safety. So we have to focus on rehabilitating and reforming and reintegrating them back to the society. So there are two things. One is reforming a person. Another thing is public safety. So in case, for example, the general public still they think the prisons are meant for punishment, right? So now we have already like the modern correctional institutions are meant for uh, reformation, reintegration, or rehabilitation. So why we are focusing on this reformation means, see, after a certain period that we have to release them to the society. So if they are not reformed, they commit further offenses, and it is a threat for the society. So public safety. So because of that, we have to focus on reforming them. By focusing on high-risk offenders, interventions can have a more significant impact on reducing recidivism rates. So recidivism, you know that term recidivism is nothing but repeated offending. So here, by integrating risk and need assessment into Indian correctional institutions, we can reduce recidivism, reduce repeated offending. By doing that, we can reduce crime. Okay, so it's a preventive approach. The need, okay. So we, again, one more one, we're going with risk, need, and responsibility. So first we talked about risk, now need. The need principle emphasizes the importance of identifying and addressing criminogenic needs. Okay, when you look at the word criminogenic needs, don't get confused. Nothing but crime causing factor. Why a person is committing crime? Okay, that is criminogenic factors. I think you might have learned a multiple factor theory. So there are multiple factors a person is committing crime. So these are factors directly linked to criminal behavior such as anti-social attitude, substance abuse, and lack of unemployment. Then treatment programs should target the specific need to reduce the likelihood of reoffending. So we have to focus on the criminogenic needs. The criminogenic needs, for example, a person is having substance abuse, means we have to focus on that particular, because of that reason they are committing offenses. So that is his criminogenic needs or crime causing factor. So we have to identify it first, then we have to give intervention programs related to that particular need, a specific need. So then rehabilitation will be effective. So in risk, need, responsibility, the first one is risk, likelihood of a person committing further offenses. Need is nothing but the crime causing factor, and responsibility is nothing. The responsive principle recognizes that offenders have different learning styles, abilities, and motivations. So effective intervention should be tailored to these individual difference to maximize chance of success. This includes considering factors such as age, gender, ethnicity, cognitive abilities, and motivation when designing and delivering treatment programs. So responsibility is nothing but, see, here we are focusing on individual tailored methods. Okay, for a person, we are identifying the risk of reoffending, we are identifying their needs, and we are providing responsibility, means intervention program related to that particular need of that offender. So that is risk, need, responsibility principle. And so why do we need the importance of integrating risk and need assessment? So first thing is public safety. By accurately assessing risk, we can better protect the public by implementing appropriate supervision or intervention measures. So you might be thinking, why do we need risk assessment? Okay, so the main thing is public safety. If you are not doing a proper risk and need assessment, if you are not giving responsibility related to that particular crime causing factors, then the chance of reformation is very low. And once they are released from the prison, they commit further offenses. So that is threat for the society. So it's a public safety. Because of public safety, we have a more integrated risk and need assessment in Indian prisons. And efficient resource allocation. So risk assessment help prioritize resources by focusing on individuals who pose the highest risk to the community. So the next one is efficient resource allocation. When we talked about classifying the prisoners based on their risk, so we have classified them into low risk offenders, medium risk offenders, high risk offenders. So you know that one of the challenges in our Indian correctional institutions are overcrowding, right? Overcrowding is one of the main issues in our Indian correctional institutions. So here, if you are identifying the risk, then we can classify them based on the risk. So low risk, medium risk, and high risk. So we can mainly focus on the high risk offenders and moderate offenders. Low risk offenders, there is no need or less need to give any kind of intervention program. There are very low chances they commit further offenses. So we can efficiently allocate our resources to mainly to the high risk offenders. Then the next importance is effective rehabilitation. By identifying criminologic needs, we can tailor rehabilitation program to address specific issues. This increase the chance of successful reintegration to society. So effective rehabilitation in the sense, like I mentioned, in Indian prisons, we do have rehabilitation programs, right? We do have vocational training, education training, meditation, yoga, recreation program. There are different rehabilitation programs we do have in Indian prisons. But what is the difference? What is the lack? What is lacking is in the sense we are not, when it comes to a prisoner, we are not assessing them. We are not assessing and understanding what is like a risk level of that particular offender committing further offense. So one thing is we are not assessing them. And the second thing is we are not trying to identify why that person is committing offense, why that person is committing offense, what is the reason behind it, what is the factor behind it, what is the crime causing factor, what is the criminologic needs. Okay, so that is lacking in Indian like correctional institutions. So you're not identifying their needs and all. So if you're not identifying the needs, what we are doing one size fits all approach, like giving all the prisoners the same kind of rehabilitation programs. Okay, so that is one of the disadvantages of our correctional programs in Indian prisons. So here, what is the benefit in the sense we are identifying that problem, why this person is committing offense. Then we are treating that particular specific problem. So there are higher chances that person rehabilitate and reform and reintegrate back to the society. And the prediction, okay. Prediction in the sense, risk and need assessment tools are designed to predict the likelihood of an individual reoffending. So using a risk and need assessment tool, we can predict, we can predict there are chances or likelihood of an like individual reoffending. So if you are conducting an assessment among the prisoners, we can predict the likelihood of a person is committing further offenses. Then by evaluating various risk factors such as past behavior, social environment, and personal circumstances, these tools provide a data-driven prediction of future criminal behavior. So that is, and this helps in making informed decision about intervention, supervision level, and resource allocation. So based on this risk and need assessment, we know what kind of intervention should be given to this particular individual, and what are the supervision levels based on their risk of reoffending, and what are the resources, where do we have to allocate our resources, and or where do we have to give more focus. So from this itself, you can easily understand that. So we have to mainly focus on high risk offenders and then medium risk offenders, right? When we are classifying them based on their risk. Then next is, okay, how we are going to treat, what we have to focus based on individual person's crime causing factor, why they're committing crime. So for that, we have to give the treatment, not the general program for all. Prevention. These tools play a critical role in preventing future criminal activity by identifying specific criminogenic needs that contribute to criminal behavior. So when these needs are identified, targeted intervention can be implemented to address them, reducing the likelihood of reoffending. So once these needs are identified, targeted intervention can be implemented to address them, reduce the likelihood of reoffending. So we are identifying their needs, then we are targeting their intervention, like specific to their criminogenic needs, then we can reduce the likelihood of reoffending. For example, addressing substance abuse or providing vocational training can help prevent future crimes. Of course, rehabilitation, criminological needs and discussion tool guide rehabilitation efforts by identifying the area where an individual requires supports or intervention by focusing on the specific needs that contribute to criminal behavior, addiction, lack of education, mental health issues. So rehabilitation program can be more effective in reducing recidivism and helping individuals reintegrate into society. Efficiency. These assessment tools enhance the efficiency of criminal justice system by ensuring that resources are allocated based on the assessed risk and the need of the individual. That means high-risk offenders receive more intensive supervision and interventions, while low-risk offenders can be managed with fewer resources. So that means when we are conducting that risk assessment, so we know that where do we have to allocate all our resources. We have to give more focus on high-risk offenders or moderate risk offenders. So low-risk offenders, fewer resources would be fine. And this target approach optimizes the use of limited resources and improved outcomes. So that means already our Indian correctional institutions, we have limited resources, right? So if we are that limited resources, if we are using for this target approach towards this high risk offenders or medium risk offenders, that would be good. Consistency. Risk and need assessment tool provide a standardized approach to evaluating individuals in the criminal justice system. This consistency ensures that decisions related to sentencing, probation, parole, or intervention are based on objective criteria rather than subjective judgment. And it promotes fairness, uniformity, and how individuals are assessed and managed. So we are by doing by implementing risk and need assessment in Indian prisons, we can have promote fairness and uniformity in how individuals are assessed and managed. Before providing probation, I think all of you know what is probation, parole, and all. So probation, parole. So any of the students, if you have any doubt, like you can ask in between. Okay, that's totally fine. So where are the applications of risk and need assessment? Where we can apply this risk need assessment tools? Okay, the court applications in court, pre-trial decisions. So risk assessment can inform. So we until now we talked about the risk and need assessment in correctional settings, right? The correctional settings, we are identifying the prisoner's risk, prisoner's need, and we are providing intervention program based on their criminogenic needs or crime-causing factors. We are classifying them based on their risk level, low risk or medium risk and high risk. So that are the application in the correctional settings. Now we are talking about the applications in the court. So pre-trial decision. So risk assessment can inform decisions on bail or pre-trial detention by evaluating the risk of flight or reoffending. So it means the time of trial, judge can, using this risk and need assessment, a judge can decide whether to give bail or a pre-trial detention, for a accused, for an accused, whether to give bail or pre-trial detention. So this risk and assessment tool is helpful in the pre-trial decisions. Apart from the pre-trial decisions, sentencing. So at the time of sentencing also it is very helpful. Judges use, like not in in India, but the developed countries, some of the countries, they have risk assessment tools, and they use not only in the correctional institution, they use in the court itself for pre-trial decisions, for sentencing. So sentencing, how it uses, judges use risk assessment to determine the appropriate sentence, considering the offender's likelihood of reoffending and what intervention may reduce this risk. Okay, so based on this, judgments can be given based on the risk or need of that particular accused. Prison applications, we already talked about prison applications. Inmate classification based on the risk. We can classify the inmates in this prison inmates, we can classify them low risk, medium risk, high risk. So, and rehabilitation programs. Programs such as anger management, vocational training, or drug treatment can be tailored to address the specific technological needs of inmate based on the risk assessment. See, based on the need assessment, we can give a specific intervention programs. We don't, we right now what we are doing is common programs for all. But what we are suggesting as per this R&R principle, identifying why they're committing crime and treat that particular specific need or specific problem. So we are treating that problem, not like a general program we are giving for everyone. So here you can be a tailored program to address their specific criminologic needs. Parole and probation applications, okay, in that also. So that is another option. Parole decisions, parole board use risk assessment to determine if an offender is suitable for early release and to identify the condition that should be imposed, mitigate the risk of reoffending. So in Indian correctional institutions, we have parole board. So before giving parole, if you're conducting a risk and need assessment, we will be having an idea whether to give parole. So if there are higher chances of committing offenses, means the risk is very high, then there is threat for the society or public safety. So giving parole to a person is a highly likely to commit an offense. It is a wrong decision, right? So in the parole board itself, they can do a risk and need assessment. Based on the risk and need assessment, they can take a decision to whether to give parole or not. And apart from that, we have probation supervision. Probation officers who use risk assessment to tailor supervision levels and interventions, focusing more resources on high-risk offenders. So in we have probation, right? So these probation officers also, they can use this risk assessment and they can tailor their supervision levels and interventions. Supervision levels in the sense, for example, probation officers, if they conduct a risk and need assessment among them probationers, then they'll be able to identify to whom we have to focus. Okay, the higher risk level, they we can more focus, and the intervention programs also based on their need we can focus. So that is another application of risk and need assessment. Then community correction applications, tailored intervention. So risk assessment guide community corrections program in designing intervention. Okay, we do have community correction programs. So if you're conducting a risk and assessment, so based on their need in community the corrections, they can provide intervention programs, such as maybe like because of a lack of employment, they can give a job training, or because of their family or marital issues, they can give counseling. So these are some of the intervention program based on their need. And monitoring and adjustment, continuous monitoring allows for adjustment in supervision and program based on changes in the offender's risk level. Okay, so now we go with the examples of risk assessment tool. Here we have LSIR, Compass, ORS. These are some of the tools. So this level of service inventory revised. This assess the risk needs across various domains, including criminal history, education, and family. So we talked about in the beginning of this class about the 8 criminologic needs, the major criminologic needs, right? So they focus on this, using this LSIR tool, we can assess their criminologic needs. These are some of the developed tools in different countries. Compass, correctional offender management profiling for alternative sanctions. So they evaluate the risk of recidivism and help in case management. And ORAS, so it is Ohio Risk Assessment System developed by the University of Cincinnati, USA. So these are, I've mentioned only like 2-3 tools. There are many tools in the risk and need assessment tool. There are many tools, okay. But we, an Indian correctional institution in India, we have a lack of this risk assessment tools. Now, for example, like I have done my research in criminologic needs and risk assessment among repeated and first time and repeated offenders. So when I have conducted my studies in central prisons in Kerala, so I went there for data collection, interacting with the prisoners. I just wanted to like assess their risk of reoffending, and I just want to understand their need or why they committed offense. So we didn't have a tool developed for Indian correctional institutions. Then what I've done is like I've conducted this Ohio Risk Assessment System, or ORAS. I've contacted one of the prisons in United States, Ohio, in the state of Ohio. Then they have told me that this tool is developed by the University of Cincinnati, and they've contacted University of Cincinnati. Then they gave free access to that particular tool. So making so that using that particular tool, I have done my studies. So if any of you are interested in conducting any research, there are some tools are free. Of course, you can access. You can contact them, and maybe you have to have an MOU with that particular university. Then they will be able to do that. You'll be able to use that particular tool for your studies. Okay. So as of now, we do not have any risk assessment tools in India. So this some of the case studies, drug codes. So in the United States, drug codes use the risk assessment to identify individuals who would benefit from treatment rather than incarceration. These codes have shown significant reduction in recidivism rate. So this is one of the case study in a drug code. Okay, drug codes in the case of substance abuse in the United States, and they do risk assessment, and instead of giving them punishment or incarceration, keeping them in the prison. Okay, so what they do means they give responsibility in the sense intervention programs based on their criminogenic needs. Here in this case, the criminogenic need is substance abuse, so de-addiction programs. So, for example, in this case study, in the case of substance abuse and they're committing crime. So substance abuse is a criminogenic needs. That is a reason why a person is committing crime in this case. So keeping them in the prison or incarcerating them or giving them treatment based on their, so their issue is substance abuse. So we had to give a rehabilitation program based on their issue, right? So the courts have shown significant reduction in recidivism rate. So so that shows that this is one of the case study that shows that if you have a risk and need assessment, and based on the need, if you are a need in the sense criminogenic needs, if you are giving intervention program, there are higher chances we can reduce recidivism. Reduce recidivism means reduce repeated offending. By the way we are doing reducing recidivism, we can we are reducing the crime rate, preventing further crime, repeated offending, and that way crime-free crime. We cannot tell crime-free. We can reduce crime rate in the society. Public safety. We're focusing on public safety and youth offender programs. In the UK, risk assessments are used to tailor intervention for young offenders, focusing on education and family support to prevent reoffending. So most of the developed countries, like for example, UK, USA, Canada, or Australia, or New Zealand, these countries, they do have risk and need assessment tools, and they assess their prisoners' risk. Not only prison, in the court also they use before providing parole or probation. Also they use this kind of risk and need assessment tools. So what they do means they conduct a risk and need assessment, and based on the risk and need assessment, they give rehabilitation programs. So individual tailor made programs for individuals. For example, when a person is having substance abuse, they give only like substance like de-addiction program. Another person is having a problem with the pro-criminal attitudes, then psychological interventions like cognitive behavioral therapy. Or if a person is having family issues, then there may be like counseling or so that is based on their need, we're giving intervention programs, not general programs for all. So there are higher chances of reformation, rehabilitation, and reintegration. So like we talked in the beginning, so the correctional institutions, the main objective of all the correctional institutions are reforming, rehabilitating, and reintegrating the offenders. Okay, not like when we, you might have already learned the theories of punishment, retributive. So now I don't think the focus is on retribution in the sense tit for tat approach, an eye for an eye approach. Okay, moral vengeance, or the person has committed an offense, so we have to give an equal punishment. So that approach is actually outdated. Okay, so the general public might be like asking for harsh punishments and all brutal punishments. So as a civilized society, and because of there are many studies have conducted. So this retribute approach or deterrence, they makes use deterrence. So there are like we are giving harsher punishment, the public would be like having a deterrence, specific deterrence and general deterrence. They may avoid committing crimes. But in the case of psychopaths or those who are in substance abuse, there are lesser chances because of any deterrence they might not commit further offenses. And when it comes to preventive theory, you know, how long we can keep the prisoner. Our prisons are overcrowding, so it is not practically possible to keep them in prison for a longer period, right? Even in the case of life imprisonment itself, our government is giving remission for the prisoners of their good behavior. So why one reason is actually reducing overcrowding in the prison, and apart from that, they are reformed. So that is then. So what are the challenges? I will try to finish within 5 to 10 minutes maximum. Then we'll have an discussion, or you can have questions. So accuracy, the challenges: ensuring that risk assessments are accurate and not biased by factors such as race or socioeconomic status. So like even if we are implementing risk and need assessment, it is not a foolproof or perfect plan. There are challenges, right? And training, ensuring that criminal justice professionals are adequately trained in using and interpreting risk assessments. Resource allocation is another problem, providing adequate resources to implement individualized intervention plans based on criminologic needs. So that is one of the challenges, right? Right now we have common programs for all, but when it comes to individualized, tailor-made programs for a particular individual, there are more resources are needed. But we can tackle that issue with focusing more on high-risk offenders and moderate risk offenders. So we do not have to focus, or we have fewer resource allocation for low-risk offenders. So best practices for effective integration is data-driven decision-making using validated risk assessment tools and regularly updating them with the new research. So like I've mentioned, some of the risk and need assessment tools, LICR, ORAS, or COMPAS. There are some tools. There are many tools like used in different countries. We in India, we do not even have a single risk and need assessment tool as of now. So we have to develop a tool, a validated tool for that. Then interdisciplinary collaboration involving criminologists, psychologists, social workers, and other professionals in assessing criminologic needs and developing intervention plans. Then continuous evaluation, regularly evaluating the effectiveness of intervention and making adjustments as necessary. We are concluding. So integrating criminologic needs and risk assessment into criminal justice system enhances the effectiveness of judicial decision, reduces recidivism, and promote public safety. So why we have to integrate criminologic needs and risk assessment in Indian prisons? Like one of the main reasons is it is very good, like it enhance the effectiveness of judicial decision. In the case of pre-trial decision, in the case of judgment, a court can use this risk assessment tools, right? And second is reduce recidivism. Reduce recidivism in the sense reduce repeated offending. We are focusing mainly on high risk offenders and medium risk offenders and why they're committing crime. That means they're crime causing factors, and we are giving rehabilitation program or responsibility related to their particular problem. Then we can have rehabilitate them. Then there are lesser chance to reduce recidivism. So we can reduce recidivism. That is another advantage. And another one is promote public safety by rehabilitating, reforming, and reintegrating them back to the society, them in the sense of prisoners. So there are higher, there are lesser chances they commit further offenses. So we are reducing recidivism. Through that, we are promoting public safety, so crime prevention aspect. So the integration is crucial across various fields of the criminal justice system, including court, prison, parole, community corrections. So these correction tools we can use in different. So thank you for listening and open for questions. Before that, like I will today we talked about what is evidence-based practice, what are criminologic needs, the 8 criminologic needs we talked about, what is risk, a risk of committing further offense, what is risk and need assessment, why do we need risk and need assessment, what is risk need responsibility principle, the importance of risk and need assessment and application of risk and need assessment, different risk assessment tools, and what are the challenges of implementing risk and assessment tools. So that's all about today's lecture. Like if you have any like questions, you can. The floor is open for questions. Yes.
Sir, could you please tell a few words about this? The word recidivism. I was a bit confused regarding the meaning of that word. I mean, not the literal meaning. I mean, this context, I got a bit confused. Could you please?
Okay, so in this context, recidivism is nothing but repeated offending. So we mainly talked about prisoners, correctional institutions, right? Penology, correctional institutions like Indian prisons. So there are like first-time offenders are there. There are habitual offenders. There are those who are committing continuously offenses. Once they are committing an offense, they are getting punishment. Once they're released, again they're committing. So they call repeated offenders. So repeated offense is called as recidivism. Repeated offenders are called recidivists. So how we can reduce recidivism, how we can stop them from committing further offense? By giving them intervention program, rehabilitation program. So recidivism is nothing but repeated offending, habitual offending. If you are not reforming them, once they're released from the prison, they commit further offenses. So it is a threat for the society, public safety. For example, a rapist, like if he is getting punishment for 7 years or 10 years or 12 years, after they're released from the prison, if they are not reformed, they commit further offense, repeated offending. So that is called recidivism. That particular person is called recidivist or repeated offender.
Thank you, sir. Thank you.
So any other questions? I don't know whether you have got that concept. It is all about integrating risk and need assessment. Risk is nothing but what are the chances of a person committing further offense. Okay, if, for example, if a prisoner, if you're assessing, what are the chances of their committing further offense? There are less chances, that is called low risk offender. Medium means there are medium, moderate chances are there. High risk means there are high chances they commit further offense. Need means nothing, crime causing factor. Criminogenic needs, because a person is committing offense because of substance abuse. It can be because of peer pressure, friends or neighborhood or friends. It can be because of pro-criminal attitudes. So there are multiple, or because of family issues, because of unemployment. So these are a person committing crime. These called crime causing factors or criminogenic needs. Okay, so we are treating their need, so we can rehabilitate them. Why we have to rehabilitate them? If you are not rehabilitating them, once they're back to the society, they commit further offense and they're threat for the society, public safety. So we have to focus on rehabilitating the offenders. Any other questions?
So, sir, shall we say, in other words, regarding this risk in this context, shall we say the person is how far the person is vulnerable to conduct a commit a crime? Is
Yes,
it correct?
yes.
Yeah, okay.
That is right. That is what risk. That's right. What are the chances of a person commit further offense? That is called a risk. And why that person is committing offense? That is called why. That why is called a need. Need in the sense why he's committing crime. Criminologic needs. Crime causing factor. Multiple factors are there. For example, if you're taking 10 murder cases, the reason behind this 10 cases might be different. The crime is same, murder, but why the 10 people have committed 10 murder cases, that might be different. One person might have committed murder because of substance abuse, means they use drug. Another person might have committed that same murder maybe because of peer pressure. Another person maybe because of family issues or a broken family, neglect, abuse, or anything. Another person might be because of pro-criminal attitude. So these are called reasons behind the committing crime. So what we are here focusing actually identifying why a person is committing and treating them with the same. Okay, for example, I mentioned multiple times regarding substance abuse. If a person is committing crime because of substance abuse, we are identifying the criminogenic need is substance abuse, and we are giving intervention responsibility to that particular need. Then they will be rehabilitated. Any other questions? I know because of online session, there were limitations to interact and all. Okay, fine. So it is an offline session, there can be more interaction and again clarify doubts. I don't know how far that you understand the topic. Okay. So I think that's all. Yes, I'm from Kerala, Thrissur. Okay, I think we can wind up. So thank you all. Thank you for giving a wonderful opportunity. Like it was like really good. I didn't get the chance to interact with many of you. Like okay, it's then still fine. Thank you.
Thank you so much, sir.
Thank you, sir.